Bismillahirrahmanirrahim and Assalamu alaikum. My name is Dr. Shanze and today the topic of our lecture is drug affecting the cardiovascular system. So let's start in. Cardiotonics. Cardiotonic agents are the drugs used to increase the contractility and output in a hypodynamic heart without the proportionate increase in the two consumption. Commonly used in a treatment of heart failure. Cardiotonics वो agents होते हैं जो कि हमारे heart की force of contraction को increase करें. ये हमारे पास आइनोट्रोपिक एजेंट्स होते हैं. हमारे पास बेसिकली टू एजेंट्स होते हैं. एक होते हैं हमारे पास आइनोट्रोपिक, एक कोनोट्रोपिक. आइनोट्रोपिक इन्वॉल्व टू इंक्रीज द फोर्स ऑफ द कंट्रैक्शन ऑफ द हार्ट एंड कोनोट्रोपिक इन्वॉल्व इन अ हार्ट रेट. आइदर दे मे बी द पॉजिटिव और नेगेटिव. So cardiotonics or inotropic drugs affect the intracellular calcium level in a heart muscle, leading to increased contractility. This increase in the contraction strength lead to increase the cardiac output, which causes the increased renal blood flow and increase the urine production. So the types of drug include the cardiac glycosides and the phosphodiesterase inhibitor. This is the enzyme. Cardiac glycosides such as a digitoxin या digoxin, commonly used drug having the cardiac glycoside origin. They originated from the digitalis purpura, commonly known as a foxglove. Mechanism of action involve the increase the intracellular calcium and allow the more calcium to enter the myocardial cell during the depolarization. That result increase the force of myocardial contraction, having the positive inotropic effect and increase the cardiac output and renal perfusion. Perfusion is a blood flow through the circulatory tissues. Slow the heart rate owing to the slowing of the rate of cellular repolarization, a negative conotropic effect. यहाँ पे वही बात कि आइनोट्रोपिक की जब बात हो तो वो इन्वॉल्व होती है हमारे पास फोर्स ऑफ कंट्रैक्शन. इफ वी टॉक अबाउट द कोनोट्रोपिक दे इन्वॉल्व द हार्ट रेट. Their positive mean increases and negative mean decreases. Positive inotropic effect means they increase the force of contraction of heart and vice versa. Then digitalis या digoxin decreases the conduction velocity through the arterioventricular node. Indication: the heart failure, atrial flutter, atrial fibrillation, paroxysmal arterial tachycardia. Paroxysmal mean something occur in sudden. आर्ट्रियल ट्रैकिकार्डिया. अब हमारे पास कंडीशन होती है हार्ट फेलियर, हार्ट अटैक एंड कार्डियक अरेस्ट. हार्ट फेलियर हमारे पास ड्यू टू द सर्कुलेटरी इशू व्हेन नॉट इनफ ब्लड इज मूविंग टुवर्ड्स द हार्ट. दैट्स कंडीशन इज नोन एज अ myocardial infarction, that is due to the circulatory issue. Then heart failure is due to the pumping ability of the heart is lost, and cardiac arrest is due to the fall in a potential generation to generate the nerve impulses as well. Then dosage of the digoxin is available for the oral and parenteral administrations. Here is the dosage and the mechanism of action. Onset of action orally. अगर हम इसको इनटेक करें दैन 30 to 120 मिनट में इसका ऑनसेट हमें रिक्वायर्ड होता है. एंड अगर हम आईवी में दैन 5 to 30 मिनट्स. Contraindication: hypersensitivity to the digitalis preparation, ventricular tachycardia or fibrillation, heart block or sick sinus syndrome, idiopathic hypertrophic subaortic stenosis. Idiopathic में ऐसी कंडीशंस या ऐसी डिजीज़ जिसका हमें हमारे पास कॉज अननोन हो उसे हम आइडियोपैथी कहते हैं. देन एक्यूट मायोकार्डियल इंफार्क्शन एंड रीनल फेलियर. एडवर्स इफेक्ट्स इंक्लूड द headache, weakness, drowsiness and vision changes. Digitalis toxicity is a serious side effect. Digitalis toxicity is a serious syndrome that occur when the digoxin level are too high. Normal level is 0.5 to 2 nanogram per ml. Sign and symptoms is anorexia, nausea, vomiting, malaise, depression, irregular heart rhythms, including the heart block, atrial arrhythmias, and the ventricular tachycardias. Antidote is a digoxin immune fab. So here's the nurse responsibilities to assess for the contraindication or cautions, perform a physical assessment, assess the cardiac status closely, including the pulse and BP. Monitor the apical pulses for 1 full minute before administering the drug. Hold the dose if the pulse is less than the 60 beat per minute in adult or less than a 90 beat per minute in infant. Retake the pulse in 1 hour. If the pulse remain low, document it, withhold the drug and notify the prescriber. Monitor the pulse for every change in quality or rhythm. We are talk about the digoxin toxicity and the nurse responsibility in it. Then administer the IV dose very slowly over at least 5 minutes to avoid the cardiac arrhythmias and adverse effect. Avoid administering the oral drug with the food or antacids to avoid the delay in absorption. Obtain the digoxin level as ordered. Monitor the patient for the therapeutic digoxin level. Maintain the emergency equipment standby. Provide to the patient teaching, including the name of drug, dosage prescribed, technique for monitoring the pulses, and acceptable pulse parameter. Dietary measures, if appropriate, measure to avoid the adverse effect, warning sign of the possible toxicity, and need to notify the healthcare provider. This is a nurse responsibility during the toxicity of digoxin. Simple as it is, there is no any rocket science. Then phosphodiesterase inhibitors. अभी हम पढ़े थे कार्डिक ग्लाइकोसाइड दैट इज डाइजोक्सिन. नाउ वी गोइंग टू स्टडी अबाउट द phosphodiesterase inhibitor that is melrinone. This drug blocked the enzyme phosphodiesterase. This blocking effect led to an increase in a myocardial cell cyclic adenosine monophosphate like a cyclic AMP, which increases the calcium level in a cell. Indication is short-term treatment of the heart failure that has no responded to the digoxin or diuretics alone, or that has had poor response to the digoxin, diuretics and the vasodilators. Dosage is the IV dose 5 microgram per kg IV bolus followed by 0.1 to 1 microgram per kg per minute infusion. Contraindicated in a hypersensitivity to the phosphodiesterase inhibitor, severe aortic or a pulmonic valvular diseases and acute myocardial infarction. Adverse effects include the ventricular arrhythmias which progress to the fatal ventricular fibrillation, hypotension and chest pain. Gastrointestinal effects include the nausea, vomiting, anorexia, abdominal pain. Thrombocytopenia occur frequently with the melrinone. Thrombocytopenia is a decreased level of the platelets. Precipitates form when these drugs are given in a solution with the furosemide. Furosemide is a loop diuretic. Nurse responsibility: assess for the contraindication or cohesion, any non-allergy to these drugs or to avoid the hypersensitivity reaction, acute aortic or a pulmonic valvular disease, acute myocardial infarction and the ventricular arrhythmias. Pregnancy and lactation: assess the cardiac status closely, including the pulse and BP. Protect the drug from the light to prevent the drug degradation. यहाँ पे बात आती है that protect the drug, that's mean they having the photosensitivity. हमारे पास एक विटामिन होता है मिकोबालामीन जो कि बहुत फोटो सेंसिटिव होता है. जब भी हमने मिकोबालामीन की टैबलेट बनानी है या इन्फ्यूजन बनाना है तब हम उसकी लाइट्स ऑफ करते हैं. ड्यूरिंग शिपमेंट कंटेनर्स की भी लाइट ऑफ होती है. ऐसा क्यों? ताकि वो उसकी API पोटेंसिटी को अफेक्ट ना करे, उसका अफेक्टिवनेस ऑफ API बरकरार ले. That's why they having the line that protect the drug from the light to prevent the drug degradation. Monitor input and output and record the daily weight. Monitor platelet count. As I told you, the side effect of melrinone is a thrombocytopenia. That's why the nurse responsibility is to monitor the platelet count before and regularly during the therapy to ensure that dose is appropriate. Inspect the skin for the bruising and the petechiae to detect the early sign of the thrombocytopenia. Bruising and petechiae is a skin disease that causes the rash, redness and the swelling of the skin. They provide the life support equipment on standby. Provide thorough patient teaching, include the name of drug, dosage prescribed, measure to avoid the adverse effect, warning sign of the problems, and the need of the periodic monitoring and evaluations. Now the anti-anginals. Angina is a condition of the chest pain, that is the angina pectoris. It is a pain syndrome due to the induction of the adverse oxygen supply and demand situation in a portion of the myocardium. Angina pectoris and myocardial infarction is a type of the ischemic heart disease in which there is a decrease in a demand of the oxygen and blood to the body. If there is a decrease in oxygen demand, this is known as a angina pectoris, and if there is a decrease in amount of the blood supply, then it is known as a myocardial infarction, that is due to the circulatory issue. Anti-angina drugs are used to help restore the appropriate supply and demand ratio in oxygen delivering to the myocardium. How they act: these drugs can work to improve the blood delivery to the heart muscle by dilating the blood vessels, increasing the supply of oxygen, by decreasing the work of heart, decreasing the demand for oxygen. Classification of the drugs used in an angina condition are nitrates, short-acting nitrate like a nitroglycerin, long-acting nitrate like a isosorbide dinitrate, beta blocker atenolol propranolol, calcium channel blocker if having the phenyl alkylamine verapamil, benzothiazepine, then daltesium, dihydropyridine, then nifedipine and amlodipine, potassium channel opener like a nicor Randil and other is a avibradine. Nitrates are the drug that act directly on a smooth muscle to cause the relaxation and to depress the muscle tone. Isosorbide dinitrate and mononitrate like nitroglycerin. Mechanism of action: they relax and dilate the vein, arteries, and capillary, allowing the increased blood flow through the vessels and lowering the systematic blood pressure because of the drop in resistance. Nitrate decreases the preload and afterload. अब जितने भी हमारे पास नाइट्रोग्लाइसरीन की डोजेज है वो सबलिंगुअली है. वाई सबलिंगुअल डोजेज? बिकॉज वेन एवर वी इनटेक इट orally they cause degraded in our GIT due to the acidity of GIT or maybe uptake by the liver first pass effect. That's why for the rapid effect the nitroglycerin taken sublingually and they decreases the preload and afterload. Preload mean हमारा वेंट्रिकल्स फुल ऑफ ब्लड है और आफ्टरलोड इज जो ब्लड हार्ट में है वो हार्ट के अंदर ही है, बाहर जा नहीं रहा ड्यू टू द आर्टरी रेजिस्टेंस. पीछे से ब्लड आ रहा है लेकिन आगे की तरफ मूव ऑन नहीं कर रहा. दिस इज एन एग्जाम्पल ऑफ प्रीलोड एंड आफ्टरलोड. नो इंडिकेशन. लॉन्ग एक्टिंग नाइट्रेट्स क्यों लिए जाते हैं? They're taken before the chest pain begin in the situation in which exertion or stress can be anticipated for the prevention of angina in adult. Taken daily for the management of the chronic angina. Short acting angina के लिए जाते हैं nitrates for the treatment of the acute angina attack and a prevention of the anginal attacks. Long acting angina हम chronic angina conditions में लेते हैं और short acting हम acute anginal conditions में. Available form: nitroglycerin available as sublingual tablets, translingual spray, intravenous solution, transdermal patches, topical ointment paste, and the transmucosal agent. They not taken, never nitroglycerin never ever taken in a GIT or orally. Dosage is isosorbide nitrate and nitroglycerin की dose and dosage, how to take, when to take, and how much time to take in. This is slide for it. Contraindication is a hypersensitivity, where anemia, head trauma or a cerebral hemorrhage, pregnancy and lactation. Adverse effect is a CNS में headache, dizziness, weakness, GI में nausea, vomiting, incontinence, CVS में hypertension, integumentary में flushing, pallor and increased perspiration. Nurse responsibility: assess for the contraindication, assess the cardiopulmonary status closely, including the pulse rate, blood pressure, heart rate, and rhythm. Always check the expiration date on the bottle and protect the medication from heat and light. Instruct the patient that the sublingual dose may be repeated in 5 minutes if relieved, not felt, for the total of the 3 doses. If pain persists, the patient should go to an emergency room. Rotate the site of the topical form. Taper the dose gradually over 4 to 6 weeks after the long-term therapy. Taper means 25% reduction in a dose. इन्होंने टाइम भी दिया ओवर 4 to 6 वीक कि हर 4 से 6 हफ्तों के बाद आपने अपनी डोज को टैपर करना है. Then beta blockers. Beta adrenergic blockers are used to block the simultaneous effect of the sympathetic nervous system, atenolol, propranolol, metoprolol. Mechanism is competitively block the beta adrenergic receptor in heart and decreases the influence of the sympathetic nervous system on these tissue. They result in decrease in the excitability of the heart, decrease in the cardiac output, and decrease in the cardiac oxygen consumption and lowering of the blood pressure. Indication is a long-term management of angina pectoris to prevent the reinfarction in a stable patient 1 to 4 weeks after a myocardial infarction. Contraindication is bradycardia, heart block, cardiogenic shock, pregnancy and lactation, caution administration to the asthma, chronic obstructive pulmonary diseases और the thyrotoxicity. अब इसमें क्या है कि caution administration to asthma आपको पहले मैंने एएनएस के चैप्टर में बताया है कि हम जब भी एक पेशेंट को कोमोबिटी हो एस्थमा एंड कार्डिक सिचुएशन सेम हो देन वी यूज़ द कार्डियो सेलेक्टिव ड्रग्स वो क्या करेंगे बीटा वन रिसेप्टर इज़ लोकेटेड ऑन हार्ट एंड बीटा टू इज़ ऑन लंग्स अगर हम उसको सेलेक्टिव बीटा वन ब्लॉकर्स देंगे कार्डिक कंडीशन में तब एप्लीकेबल है अगर हम बीटा टू ब्लॉकर देंगे देन दे अफेक्ट एस्थमाटिक कंडीशन क्योंकि बीटा टू हमारे पास क्या करवा रहा है ब्रोंकियोडाइलेशन अगर हम ब्लॉकर्स देंगे पेशेंट एस्थमेटिक है देन दे वर्सनिंग द कंडीशन डोजेज इज ओरल एंड आईवी nurse responsibility to assess for the contraindication or caution do not stop this drug abruptly after the chronic therapy but the taper gradually over 2 weeks. Monitor the BP, pulse, rhythm, and cardiac output regularly. Continuously monitor any patient receiving an intravenous form of these drugs. Calcium channel blockers are amlodipine, diltiazem, nicardipine, nifedipine, and verapamil. Mechanism of action involve the blockers. They inhibit the movement of the calcium ion across the membrane of the myocardial and the arterial muscle cell, altering the action potential and blocking the muscle cell contraction. This will result the loss of smooth muscle tone, vasodilation, and decrease the peripheral resistance occur. Decreases the preload and afterload, which result in decreases the cardiac workload and oxygen consumption. Indication: the treatment of the premenstrual angina, the chronic angina, affect the associated angina. Hypertension verapamil is also used to treat the cardiac arrhythmias because it slows the conduction more than the other calcium channel blockers do. Contraindications: the hypersensitivity, pregnancy, lactation, caution should be used with the heart block or sick sinus syndrome, renal or hepatic dysfunction, and heart failure. Adverse effect: in a CNS they causes the dizziness, lightheadedness, headache, and fatigue. In GI causes the nausea and hepatic injury related to the direct toxic effect on a hepatic cell. Cardiovascular में hypertension, bradycardia, peripheral edema, and the heart block. Skin में flushing and rashes and flushes. These are the condition of the skin. Then nurse responsibility: they assess for the contraindication, inspect the skin for the color and integrity, monitor the BP very carefully, and provide thorough patient teaching. Potassium channel opener. Potassium channel opener activate the ATP sensitive potassium channel, thereby hyperpolarizing the vascular smooth muscles. This result in reduction in the vascular tone that will lead to decrease in a preload and afterload. First as a Nicorandil. Dosage is oral 5 to 20 mg. Indication: prevention and the long-term treatment of the chronic stable angina pectoris. Reduction in the risk of the acute coronary syndrome in a patient with the chronic stable angina. Contraindication is a hypersensitivity, cardiogenic shock, and hypotension. Actually, there is a 3 type of angina, that is stable, unstable, and the premenstrual angina. Then side effects of the calcium channel opener is the flushing and palpitation, weakness, headache, dizziness, and vomiting. Nurse responsibilities. They assess the hypersensitivity and contraindication, regular monitoring of the vital signs. Health education assess the oral cavity for oral ulcerations. Other is the avabradine is a newer type of the drug. Mechanism of action it's act by reducing the heart rate by the specific inhibition of funny channel that is a Allahu Akbar, Allahu Akbar. Mechanism of action it acts by reducing the heart rate by the specific inhibition of the funny channel like a cyclic nucleotide gated. It specifically inhibits the cardiac pacemaker and thereby reducing the heart rate. Indication is chronic stable angina patient with the normal sinus rhythm and chronic heart failure. Dosage is orally by 2.5 to 5 mg. Contraindication is resting heart rate less than 70, cardiogenic shock, acute myocardial infarction, sick sinus syndrome, severe hepatic injury, pregnancy and lactation. Side effect is blurred vision, bradycardia, syncope, headache, constipation and muscle cramps. Syncope is the loss of consciousness. Nurse responsibility is check for the hypersensitivity and contraindication, assess the pulse rate and blood pressure, check the liver function test regularly, check for the visual disturbance and health educations. Now the next topic is antihypertensives. Hypertension. What is a hypertension? Hypertension is the increase in a arterial blood pressure. Then the regulator of the blood pressure. Antihypertensive drugs used for the treatment of hypertension. Classification is diuretics like a loop diuretic, furosemide and ethacranic acid, thiazide diuretic, hypochlorothiazide, chlorothiazide, potassium sparing diuretics such as a spironolactone, adrenergic inhibitors, centrally acting alpha adrenergic antagonists like a clonidine, periphery acting alpha adrenergic antagonists as reserpine, alpha adrenergic blockers like a prazosin, beta adrenergic blocker like a atenolol, calcium channel blocker like a amlodipine and nifedipine, angiotensin inhibitor, angiotensin converting enzyme inhibitor, captopril, anapril, angiotensin 2 receptor blocker, losartan and telmisartan. Here's a question कि ACE inhibitor का सबसे बड़ा side effect ये है that they cause the dry cough due to the reduction in a metabolism of the bradykinin. To overcome this, we use the angiotensin 2 receptor blockers. Direct vasodilator like a nitroglycerin and sodium nitroprusside, diuretics that increase the production of urine, loop diuretic they inhibit the sodium and chloride reabsorption in a thick segment of the ascending limb of the hypophanly as well as in a proximal convoluted tubule and a distal dilating side like a furosemide, brand name is Lasix, dosage is 40 mg per oral 3 times a day. Thiazide diuretics they inhibit the sodium and chloride reabsorption in distal convoluted tubules. These drugs are the first line drug used to manage the essential hypertension when the drug therapy is needed. For example, hypochlorothiazide dosage is 25 to 100 mg per dl. Now potassium sparing diuretic they are not as much as powerful as loop diuretics but they retain the potassium instead of wasting it such as spironolactone and amylorides. Mechanism of action they act as a aldosterone antagonist blocking the action of the aldosterone in a distal convoluted tubules. It decreases the elimination of potassium. Dosage is 50 to 100 mg per day per oral. In a contraindication is hypersensitivity, fluid and electrolyte imbalance, where renal failure, caution administration with systemic lupus erythematosus, GOIT, pregnancy and lactation. Side effects, common side effects, GI upset, fluid and electrolyte imbalance, hypertension, electrolyte disturbance. Side effects of the thiazide and loop diuretics are hypokalemia, weakness, muscle cramps, and arrhythmia. Hypercalcemia, decrease excretion of the uric acid. Side effect of the potassium sparing diuretic is hyperkalemia. As it is a potassium sparing, they inhibit the wastage of the potassium, so their side effect is hyperkalemia, lethargy, confusion, ataxia. muscle cramps, and cardiac arrhythmia. So, thank you. This is all about the drugs used in a CVS condition. The condition we study is the angina, heart failure, and the hypertension. Thank you.